One of the most contentious reopening debates has been around places of worship. In Mississippi last week, someone burned down a church that had sued to reopen last month and spray painted on the pavement, quote, "Bet you stay home now, you hypocrites." This past Friday, the president demanded houses of worship get to reopen across the country.
The governors need to do the right thing and allow these very important, essential places of faith to open right now. For this weekend. If they don't do it, I will override the governors.
And here in Massachusetts, houses of worship have been allowed to open for more than a week now, but many are choosing not to exercise that right so far, concerned that it's still not safe to bring people together. I'm joined now by Reverend Irene Monroe, syndicated religion columnist, co-host of GBH's All Rev'd Up podcast, and a regular on my favorite show, Boston Public Radio. Dr. Thea James, been here before too. She's the Associate Chief Medical Officer and Vice President of Mission at Boston Medical Center. She's also an emergency room physician. Reverend and Doctor, it's good to see you both. Thanks for being here.
Listen, glad to be here. Can I throw not only a kiss to you, Jim, but most importantly to Thea, because this is the most I've seen her.
Well, that's where I want to start. For those that didn't know, if you read Renee Graham's fabulous piece in the Boston Globe, all of New England now knows, in addition to everything else I mentioned, you two are married. In the piece, Irene, it said you were living in the basement. Are you in the basement now?
Yeah, I'm in the basement. Now, the very interesting thing about Cambridge, they call the basement apartment a garden apartment because you have a separate entrance, bathroom, and bedroom. But it is the basement, and the only plus, she has the best part of the house. The only plus about this is that I got all the liquor.
So, Doctor, why are you upstairs and your spouse is in the basement, for those who didn't see Renee's piece? Why are you alone and together?
Well, I think a lot of it has to do with my job and where I work and what I do. And even though I'm in the emergency department only a couple days a month, I'm proximal to it. I'm walking around, the hospital, during the day. And so, as Irene calls it, it makes me a hot spot. So right. I think it's just, it's really, really safer for us to live this way.
And also, Jim, I have to say, I'm doing funerals. So that's also a problem, too. So she's a hot zone and I'm radioactive.
Well, I wanted to talk to you about that, what you're doing when you're not social distancing in your house. I know you've done officiated over dozens of funerals. I can't imagine how impossible that is when so many people who lost someone they love may not have been able to be with them as they were dying, can't even be physically together and touch each other after a person has passed. How impossible is it for both you and those families, Reverend?
Well, for me, it's incomplete. It reminds me of two particular incidents in history, and they were tragic. The AIDS epidemic, when clearly the volume of people dying, but not to this volume. And it also reminds me of 9/11, where you would do funerals and the bodies are not there.
Yeah. Staying on that for a second, though, what I think I read in Renee's column, correct me if I'm wrong, is some of these funerals you've presided over on Zoom, some you've been the only person in the church. Speaking of that, I mentioned in the lead to this thing, churches opened in Massachusetts on day one of phase one. The governor acknowledged us on the radio the other day that it was in part a function of the fact that there was going to be a constitutional challenge. Should they be open this early, even at reduced capacity?
Well, the interesting thing here, you always are in this argument about First Amendment rights, separation between church and state. And just because it's legal doesn't mean it's the right thing to do, particularly during an epidemic when public health is a big issue here. And there are alternatives.
I'm sorry.
I was just going to say there are alternatives. It's not restricted.
Like what?
And it's asking you not to congregate. So that's why streamlining is very good. But if you've watched, worship services online, that shows you there are alternative ways to do this.
Doctor, can I move to your day job when you're not social distancing at home? We've heard a lot of talk about the most vulnerable populations, which obviously is what Boston Medical Center serves. We've talked about the disproportionately negative impact on people of color and low-income people. Has action on these issues matched the amount of talk we've heard in the last couple of months during COVID-19?
Well, I think most of the action is going to have to be some intentionality about what we do going forward to prevent these types of things from happening to people. And mostly it's the root causes, that put people in these predicaments of having all of these sorts of comorbidities. Because when people are coming from communities that have been traditionally, historically disinvested in, they actually don't have the ability to prioritize health. They have limited resources, and they are, trying to figure out, how do I allocate my resources? Do I use them to pay rent and buy food and that type of thing, or do I use them for a doctor's appointment or a copay of some sort? And so when they get stressed by something like COVID, they really don't stand a chance. And so we have to have some intentionality about addressing our patients. Shifting the healthcare paradigm to focus on root cause, to disrupt the things that lead to the predicaments that many of our patients are in.
Well, staying on this just for a second, for much of our community, unfortunately, our city, our area, the issues you've raised have been under the radar. I know they're not for people like you who serve people as you do and as you've done for decades. Are you of the belief that now that we've shined the light on these grotesque inequities, that we do focus on them post-COVID-19, or it goes back to the back burner like it's been for so many public policy people for years?
Jim, that is worrying me. That is at the top of mind for me right now, because people have short memories. And when we think about what we're going to do and want to do going forward, it cannot look like what we talked about pre-COVID, because we talked about determinants of health pre-COVID. But what those things look like going forward have to be different. They have to be intentional around disrupting the sort of root causes that land people where they are. They can't just fill gaps for people. They have to eliminate the gap.
So before we leave, let's go back to the beginning. I feel like I'm doing a public service by bringing the two of you together. And I know you call each other and do. Is there anything you want to say to each other while you're with us? Irene, Thea, anything you want to say to each other?
Oh, absolutely, because in the house we wear masks. So, like we're together. Like Sunday we went to a concert in the living room. That's a shared space. We were on opposite sides of the living room, and we listened for 2.5 hours to Yo-Yo Ma.
That was beautiful on PBS. Absolutely. By the way, done at GBH, as I'm sure. So is there anything you want to say to the doctor before you leave there, Reverend?
Yeah. Well, this is another virtual kiss, but it's through Jim. So take
my
it for
pleasure.
what it's worth.
I'm glad to be. Not much. And doctor, anything you want to say to the Reverend before I let you go?
Yes. I just want to tell her thank you for making it livable, the fact that we can sort of like be apart and together at the same time. It's a little bit miserable, but at the same time, there's a lot of diligence that goes into it, and a lot of
creativity. Yeah, and a lot of creativity. And it does help that the liquor is downstairs in the basement.
All the wine is all down there where she is, so she has an advantage.
Well, I feel like I've performed a public service, and you are welcome. Reverend Irene Monroe, Dr. Thea James, my neighbors as well, I should say. Good luck to both of you. Thanks so much.
Thank you.
Thank you so much. Have a nice evening.